Welcome and good afternoon. Today is Tuesday, August 22nd. I hereby call the Insurance Subcommittee to order. Madam Secretary, please call the roll.
Representatives Capley, Sapicki, Himmer, Hicks, Kumar, Lafferty, Martin, Mitchell, Rudd, Rudder, Terry, Chairman Haynes.
Here.
Chairman Haynes, you have a quorum.
Thank you. Before we get started, are there any personal orders? Seeing none, we have 4 bills on the calendar today. First item is number 1 is House Bill 7032 by Chairman Williams. We have a proper motion and second. Chairman, do you have an amendment?
Yes, ma'am. I think the Speaker's office did file a timely filed amendment. I guess they're all timely filed, though. Drafting code 009530.
That's correct. Is there a motion and second on the amendment? We have a proper motion and second. All those in favor of putting the amendment on the bill, say aye. Opposed? The ayes have it. The amendment is on the bill. Chairman, you can explain your bill as amended.
Thank you, Chair Lady and members. This bill, I've been working through the summer. One of the biggest challenges many of us face in our communities is our emergency rooms are full of mental health patients. Our mental health services are overran with patients. And the biggest challenge is when I talk to providers is that they can't even make ends meet. In my district, we have a mental health crisis, and we had a mental health provider who came in and we gave them free rent at the local hospital to try to give services to our local community. What ended up happening is the reimbursement rates were so low that they couldn't even make ends meet then, and ended up having to close after 2.5 years. And so what we found is that it didn't matter whether it's inpatient care or outpatient care, the reimbursements that we're getting in this space are so far under what it costs to cover, so far under what would enable them to cover costs, that no one's going into this business, which is what's created and exacerbated a shortage of mental health care services in our state. What this bill would do is seeks to raise those mental health minimums and in the mental health care space so that those costs can be covered and that more Tennesseans can get the services that they need, not just in Metro Nashville, but also in rural districts like mine and Representative Capley. So that, Chair Lady and members, to give you an idea, I did a little bit of research currently. If you look at the CMS codes, the reimbursement rate, and Tennessee Association of Mental Health folks gave me this, for instance, a diagnostic of what the reimbursement rate for a diagnostic evaluations for a licensed professional is $98. In order to cover costs, they're going to need another $75.80 just to cover the cost per mental health provided under that CPT code. And so when you look at what it costs in order to do that, a licensed mental health provider who works 2,000, I call it 20 and 80 because that's what we do in my business, 2,080 hours a year, which is 40 hours a week for 52 weeks. If someone were to do that, just an entry-level licensed therapist, they're going to make $27,000 a year if it were just reimbursements. And that's why no one's going into the field. That's why these folks are really called to do this, that are doing it now. And so the hope here is with this bill that we could find a way to generate some additional resources for these mental health providers across the state. And this would apply to both inpatient and outpatient care. So.
Thank you for that explanation. Do we have any questions from members? Dr. Kumar, you're recognized. Chairman Kumar.
Thank you, Chair Lady. Thank you for bringing up this matter. Of course, reimbursement has been lagging for a long time for healthcare providers. And of course, we've always heard, how Washington or the person running for office at the federal level is going to balance the budget and do things. And the perennial answer has been, we'll cut Medicare and waste and fraud and so on. So there has been a tendency to cut that down, and it became even worse after the Affordable Care Act. But one fact is that if a practitioner goes into practice by themselves as a mental health professional or the medical doctor, their reimbursements are at a particular level. On the other hand, if they go to work for a corporation, that would be Ascension, Centennial, or one of these big people, the reimbursement that those people get for the same service provided can be as much as 3 to 5 times more. And that has created a disparity. And I don't think we can address it ourselves at the state level, but that is part of the reason that most of these providers and physicians want to go work for a corporation. They can pay them more money, but what they can get by way of reimbursement, they still themselves make money also. And that has really changed the shape or the face of healthcare in how we get healthcare, because we no longer have physicians or healthcare providers who feel a responsibility to the patient. The patient doesn't belong to them. It belongs to the organization they're working for. But I think that's something to explore for our smaller communities who cannot have providers of this kind, to let them be employed by the hospital entities, and reimbursement is better. I just wanted to draw attention to that disparity. Thank you.
Any other comments? Seeing none, we are ready to vote. All those in favor of sending House Bill 7032 to insurance full signify by saying aye.
Aye.
Opposed? The ayes have it. Bill goes to insurance full. Item number 2 is House Bill 7069 by Representative Parkinson. We have a proper motion and second. Representative, you're recognized on your bill.
Thank you, Chair Lady. And if you will, can I get a roll call vote on this, please?
Okay, without objection, we will have a roll call vote.
Thank you, Chair Lady. What this bill does is it gives the governor permission to apply to CMS to increase the eligibility for TennCare, specifically only for mental health services. That would allow 340,000 more Tennesseans to be able to have access to mental health services. We are in a mental health crisis. This would drastically improve some of the challenges that we're dealing with when it comes to mental health. And with that, I hope that the committee will pass this to the next committee.
Do we have any questions from members? Seeing none, we are ready to vote. Madam Secretary, please call the roll.
Representative Capley? No. Representative Capley votes no. Representative Sapicki? Representative Sapicki votes no. Chairman Haynes?
Abstain.
Chairman Hilton abstains. Sorry. Representative Himmer? Representative Himmer votes aye. Representative Hicks? No. Representative Hicks votes no. Representative Kumar? Aye. Representative Kumar votes aye. Representative Lafferty. No. Representative Lafferty votes no. Representative Martin? No. Representative Martin votes no. Representative Mitchell? Aye. Representative Mitchell votes aye. Representative Rudd? No. Representative Rudd votes no. Representative Rudder? Yes. Representative Rudder votes yes. Representative Terry? No. Representative Terry votes no. You have 4 yeses and 7 nos.
The bill fails.
Thank you, Madam Chair. Thank you, committee. Thank you for the aye votes. Appreciate it.
Item number 3 is House Bill 7088 by Representative Harris. I don't see him here. We will roll that to the Hill. Item number 4 is House Bill 7065 by Representative Himmer. Do I have a motion and a second?
Motion. Second.
I have a motion and a second. Representative, you're recognized on the bill.
Thank you very much, Madam Chairwoman. Appreciate very much. Well, unfortunately, I got a nasty fiscal note on House Bill 7065, so I will be intending on taking that off notice, but and bringing this back later when we have a regular session this January. But just for the members of the committee's benefit, there are a few other states that have taken the Section 1 11, 15 waivers and created these supportive housing programs. Actually, the city of Nashville is about to open a brand new 90-bed unit just a few blocks from here. We'll have to have everyone down there when it gets open. We're actually going to name it after Charles Strobel, who Reverend, who we just honored this morning, who created our Room at the End program. But you'll see a lot of other states have taken these 11, 15 waivers and created these supportive housing programs to help with their homeless and mental health, mentally ill populations. And they've been very, very helpful and done great things in getting these people that need these much needed services back on the right track and road to recovery. And we've seen, states, Florida, Oregon, Arizona, to name a few, have done these over the last few years. Spoken with the TennCare medical director and some of the staff about this as well. And so I think this is kind of a wave of the future, and think this will be a great thing for Tennessee, and look forward to bringing that next year. With that, I'll take the bill off notice, ma'am.
Okay. Chairman Rudd, did you want to say something?
Yeah, pardon me, I printed your bill off and I'm reading it, but I didn't see the physical. What is it?
Let me see. I think it was 100. So let me find it here. 43 million increased state expenditures, and then 82 million increased federal expenditures.
A little bit. I didn't know what it was. Okay,
You
thank
can
you.
take it from your piggy bank if you like. So.
Thank you. Thank you for that explanation. So without further notice, we will take that off notice. We're back to item number 3. 7088 by Representative Harris. I do not see him here. Without objection, we're taking House Bill 7088 off notice. That concludes our calendar. Before we close, does anyone have any announcements? Representative Hammer?
Thank you, Madam Chair. I want to take a personal privilege and recognize a constituent who next time we meet in subcommittee, we'll probably have a new nameplate here, but our attorney, Caroline Miller, is going to be getting married next month. And so we want to congratulate her and have best wishes for her.
Congratulations. Any further announcements? Seeing none, do I have a motion to adjourn? We have a motion and a second. The Insurance Subcommittee is closed, subject to the call of the chair.